Hi, I'm Justin Riley. Today on Wisconsin Doctors, we'll learn about the advancements of laboratory services here in our healthcare industry and find out when it's appropriate to request a prescription from your doctor. I'll be joined by Lisa Beers, who is a staff pharmacist here at Bluff Medical Center. She's been here since 2012 and received her training from the University of Iowa and Augustana College. Craig Griffiths is the director of the pharmacy here at Bluff Medical Center. He received his training from Ferris State University and the University of Minnesota. He's been a pharmacy director for over 30 years, but has been at Bluff since 2015. Stan Machachok is the laboratory director, has been with Bluff since 1985, and received his education at the University of Wisconsin-Eau Claire. And Carly Thayer, lab technologist here at Bluff Medical Center, went to Western Technical University at La Crosse and the University of Cincinnati and has been with Bluff Medical Center since 2002. It's all coming up right here on Wisconsin Doctors on CW57. Stay right here. Welcome back to Wisconsin Doctors. We're here at Bluff Medical Center on location in Mauston, and we'll be talking first with Lisa Beers, who is the staff pharmacist here at Bluff. Lisa, welcome to the program.
Thank you.
So, I think a lot of folks have a pretty good idea of what happens in a retail pharmacy, your Walgreens or CVS, but what happens in, talk to us a little bit about what happens in a hospital pharmacy.
Sure. Well, of course, we're responsible for dispensing the medications to the hospital patients in the outlying clinics. Also, each time a physician puts in a medication order, a pharmacist is responsible for reviewing it. So we're looking for things like appropriateness, such as drug and dosage. Also, if there's any potential drug interactions, and if there's any patient allergies that could potentially be a problem. Also, when a patient is admitted to the floor, a pharmacist will usually go and do their medication history. We also do these in the pre-op clinics that you guys talked a little bit about in episode 1. We do have a cancer care center in the hospital, so we prepare chemotherapy products for the oncology patients and check those. And we also have a staff member, generally a pharmacy technician, that goes to each code blue. So that would be when a patient goes into cardiac arrest.
So it sounds like the pharmacists here are a lot more involved in the care of a patient than, obviously they would be at a retail location.
We stay pretty busy.
Yeah, absolutely.
Tell them a little bit about what they might experience patient to pharmacist while they're here.
Well, usually when a patient is admitted to the floor, a pharmacist will come out and take your med rec. What this means is we're going to go over each drug that you're taking at home, the dosage, if there's any special way you take it, things of that nature. We'll also check on your allergies and what your preferred pharmacy is. And of course, if you have any questions for the pharmacist, we will be happy to answer them at that time.
Very cool.
So Lisa, can you explain why it's so important for viewers or for patients to be able to know what medications are on?
Sure. I think there's a couple of reasons. A big one for me is really just patient empowerment. I really believe that everyone should understand each drug they're putting in their body, why they're putting it in their body, and what the best way to take it is. You also want to know if there's any side effects or anything like that you should be on the lookout for. This is really going to help a patient to have the best possible health outcome that they should. Another reason is also so that they're able to tell their doctor what medications they're on, or when they go into the hospital, what medications they're on. A lot of times patients make the assumption that we know what they're taking because we're their healthcare provider, but that's not always necessarily the case. A lot of patients have multiple different doctors that they might go see, so different prescribers, and they also might be taking things over the counter that their healthcare providers would need to know about just to look for drug interactions and things like that.
So do you have any tips or recommendations for people to help them keep track of their medications?
Sure. A big thing is that you should always keep a medication list in your purse or wallet. You want to make sure that you update that when anything changes. This is just so you have a rapidly available list that you can give to your doctor when you go for your appointment or if you go into the hospital. You also might find it helpful to use a routine for taking your medications. So if a patient has a lot of daily meds, they might want to take them with their morning coffee. They could set the pill bottles out next to the coffee pot, or maybe out on their placemat for when they take breakfast. Just something that will trigger their memory to take their medications. Obviously, some patients do have a more complex medication regimen. They might find it helpful to use a pill box. So you have the separate days of the week and the times where you can set your meds up. And finally, I think it's really important to try and get all your prescriptions filled at one pharmacy if it's possible. Kind of have a pharmacy home. And this will help the retail pharmacist to screen all your drugs to see if there are any potential interactions or duplications in therapy, anything of that nature.
So it sounds like a big part of that is setting up healthy habits for remembering to take those pills on a daily basis.
Yes, you just want to find whatever is going to work for you and try to stick with it.
And then also trying to do a one-stop shop at whatever pharmacy you do choose to go to.
That is definitely preferable.
Yeah. If a patient has any questions about any kind of medication, who's the first person that they should call? Should they call their doctor? Should they call a nurse? Should they call a pharmacist? Who should they call?
I would recommend they either call their doctor or their pharmacist. You can call either your retail pharmacist, or you can certainly call us in the hospital in the inpatient pharmacy and just ask to speak with a pharmacist. The most important thing is to reach out to someone and get the information that you need.
Lisa Beers, staff pharmacist here at Mile Bluff Medical Center. Thank you so much for the info.
Thank you.
Don't go away. There's more Wisconsin Doctors coming up right after this. Stay tuned. Welcome back to Wisconsin Doctors. We're here on location at Mile Bluff Medical Center in Mauston, and next we'll be talking with Craig Griffiths, who is the director of the pharmacy here at Mile Bluff. Craig, welcome to our program.
Thank you. I'm glad to be here.
Good, yeah, and as I understand, we're going to be talking about antibiotic stewardship today, and this is something that I've been hearing more and more about. Can you talk to viewers a little bit about what exactly is antibiotic stewardship?
Sure. Well, antibiotic stewardship, as the name implies, is the wise and prudent use of antibiotics. And it's a program that stemmed out of some resistance problems we've seen on a national and international level. And basically, the content of antibiotic stewardship is to optimize your antibiotic therapy, making sure that you're using it only when you need them. You're using them then to treat and to prevent disease appropriately, including targeting the right antibiotic for the bacteria that you're treating, and then making sure that you minimize side effects and adverse events for your patient, and then long-term for your community in terms of resistance and stuff. A good antibiotic stewardship program will include things like prevention, education, education for the professionals as well as the lay people that are involved with the process, and just consistency in how you deliver your care.
Yeah,
Yeah.
very good.
Can you tell us a little bit about why antibiotic stewardship is so important?
Well, in 2006, the Center for Disease Control identified a multi-drug resistant tuberculosis bacteria that they were afraid we wouldn't be able to treat. And they projected that that would start to happen with other bacteria, and indeed it has. And so what we're targeting, not only here, but across the country in terms of antibiotic stewardship, is to try and minimize those resistance problems by making good use of antibiotics at appropriate times and for appropriate reasons. So.
Yeah, absolutely.
So if a prescription isn't always needed, can you tell us why a prescription was prescribed when it's not really necessary?
Well, there are instances where the diagnosis isn't clear, and so we have to make a decision to use an antibiotic or not use it on incomplete information. And so there are times when we give an antibiotic because we just don't have enough information to make the better decision, perhaps in this case. But there are other instances, more commonly, it's the expectation of the patient or society in general to be treated for something. According to the Center for Disease Control, 68% of the antibiotics that we give for respiratory infections are inappropriate, they're unnecessary. But in 80% of those prescriptions, they're prescribed under duress. In other words, the patient or the patient's parent or whatever the case may be expects an antibiotic to treat what they believe is an infection that will respond. And so education is really important. We need to start reaching out to everybody, professionals and the community, to get, to help them understand that you don't always require an antibiotic to treat an infectious process. So.
Yeah, and a lot of those things, as I understand, start out as viruses and not bacterial
Well,
infections.
and in many cases, it is a virus and it just needs to run its course, and we don't accept that. But and certainly, viral infections can progress into a bacterial infection that would require an antibiotic. But that's a call that the physician needs to make based on the clinical presentation. So it can be difficult.
Yeah, absolutely.
So Craig, this doesn't sound like it's just our region. Is this a national issue?
This is actually an international issue. In fact, President Obama put some laws into effect for our country to start regulating and directing how we use antibiotics and how individual hospitals as well as broader organizations react to the resistance problems that we're experiencing. But one of the things that he committed to was actually working with other governments to advance research and development on antibiotics so that we could find antibiotics that might have better effectiveness over the course of the next few years. So it's international.
That's very good information. We just have a couple seconds left. I'm wondering if you can talk to viewers about what their role in antibiotic stewardship is.
Well, the biggest thing is prevention. So proper immunization, and certainly the old standbys: get lots of rest, eat properly, drink lots of fluids, get some exercise. All of those things help with your immune system and stuff, and then just be somewhat educated. Read, understand what it is that different infectious diseases might come from, so that you avoid those situations, and certainly stay out of situations where you might be exposed to things. So.
Yeah, absolutely. Well, Craig Griffiths, Director of the Pharmacy here at Mile Bluff, thank you so much for the information.
That's okay.
Don't go away. We've got more Wisconsin Doctors coming up right after this. Stay tuned. Welcome back to Wisconsin Doctors. We're here again on location at Mile Bluff Medical Center here in Boston. And next we'll be talking with Stan Maciejczak, who is the laboratory director. Stan, welcome to our program.
Oh, thanks for inviting me.
Yeah, so talk to us a little bit about your role as the laboratory director.
Well, my role as a laboratory director, that's a big question. First, I'd like to start out by saying I've had this position since 1996. Prior to that, I was a staff tech, and then I took a lead position and assistant director role. And I only say that because I've been here 30 years. I just celebrated my 30th
Congratulations.
anniversary here in last May, so
Yeah.
I have a lot of history. But back to your question, I think the biggest role I have here is ensuring that we're compliant with all the regulations that we have that we have to follow.
And I would imagine there's a lot to think about in that.
There's a lot to think about. Last March we had our Joint Commission survey, and we're a Joint Commission accredited facility. So a surveyor spent 5 days here looking at our lab and then the 4 other labs that we're responsible for. Went through all of our documentation, all of our results, and told us that we were doing a great job. So.
Good, excellent, good to hear.
So that's so those are the big things we do. I also do things like budgets, all those fun staffing things, and
Number
things that we have to
crunching.
find. Yeah. All the roles that a director here at the facility has to accomplish and get done within a timely manner. So.
Yeah, absolutely.
So Stan, since you've been here for 30 years, can you tell us what you've seen, the most significant changes in the time that you've been here?
Well, I think the biggest change we've had is when I started, I was one of 7 employees in the laboratory, and now we have 31.
Oh,
so
wow.
There's 31 people. And we've grown into a new facility, a new place in our new laboratory. It's about 4 times larger than what we had started out having. I couldn't tell you how many tests we did back in the days when I first started here, but last fiscal year we did 400,000 plus tests here.
400,000 in 1 year?
In 1 year we did 400,000 tests. And I'd like to say 98% of those are accomplished here within our facility.
Wow.
So
That's more than 1,000 a day.
that is a lot of tests.
7 days
isn't
a
it?
week.
Yeah.
Wow.
So we've really done that through automation. you just can't do it with the amount of people that we had when we first started.
Right.
So.
Yeah, absolutely.
And what are some of the most common lab tests performed at
Well,
Mile Bluff?
I think as far as the viewers go, probably the biggest ones would be like a complete blood count or a CBC. That's a big test, and that includes things like your white blood count, your hemoglobin, hematocrit, platelet count. It's done generally as part of a physical, or if you come in and you're ill, it'll give us some indication of what's going on. Some of the next biggest ones, like a lipid profile, things that include triglyceride, cholesterol, HDL. That's just standard testing, and everybody should have those done on a routine basis to see if you're having issues with those. Other things like protimes, people that are on Coumadin therapy or warfarin. It's very important for us to be able to test those and make sure that they're not becoming too elevated.
Now, are these tests, are these something that, any of the tests that you guys do, something that we need to get like a referral from our primary care physician first?
We have, any test that we do within our facility has to have a written order from a provider.
Okay.
And as long as we've got that, we can usually accomplish what you need.
Sure. Sure.
Stan, everybody wants their results right away, but obviously that's not realistic. What is a realistic time frame to expect for results?
Well, that's a really good question, because we get that a lot. It's kind of funny to think that it doesn't take very long, but a CBC, like I had said before, takes about 10 minutes after we get a sample. They're that fast. ProTime's about 15 minutes. Most of our chemistries and all the rest of our tests are done within the first 1 or 2 hours that we have a sample. We don't batch a lot of tests anymore. Most of it's available to the provider at a really short basis, and that's the important part, is to get the results back to the provider as soon as we can.
We talked a little bit about some of the changes that you've seen in the last 30 years. What do you anticipate as far as changes, maybe even in the area of technology for lab testing in the future?
Well, I think we're going to see a lot more automation than we're able to do right now, and especially smaller labs. Some of the bigger labs, they've got some automated systems, but they're just not practical for us. And I think we have to go down that road, just because there's going to be some challenges coming up in the future. We're going to have some retirements in our profession. Laboratory profession on its own, there are a lot of people going in and out of it, so we're going to get a lot of retirements.
Yeah.
It's going to be kind of a tough thing to try to fill those positions.
Yeah.
And I think molecular testing is probably going to be the next big platform that we start to approach a little bit more. Getting tests done at a higher accuracy and things that we actually can't do here now. And actually, Carly's going to talk about that in her segment.
Yes, she is. And when we come back, Carly will talk to us a little bit about that. Well, Stan Machechak, thank you so much for joining us today.
Thank you.
And when we come back, Carly will talk to us about some of the upcoming changes in the lab. It's Wisconsin Doctors on CW 57. Welcome back to Wisconsin Doctors. We're here on location at Mile Bluff Medical Center here in Mauston. And next we'll be talking with Carly Thayer, who is a lab technologist here at Mile Bluff. Carly, welcome to the program.
Hi, thank you.
So talk to us about what it is that you do as a lab technologist here.
Well, here at Mile Bluff, we are all generalists, and that just means we rotate through every department we have. We do chemistry, urinalysis, hematology, blood bank, and microbiology. And a few years ago, I became lead of microbiology with another coworker. And just in October, I started working with the infection control department. It kind of ties in with microbiology.
Very nice, very nice.
Stan mentioned some of the advancements that have taken place in the lab. Can you tell us about the newest technology that was introduced this spring?
Yeah, we're really excited about our new instrument. It is a microbiology instrument. It's the Verigene by Nanosphere, and it does molecular testing. It actually tests the DNA of the bacteria, and we use it for stool samples to test for pathogens, and we use it for blood cultures now. And it is something new that for blood cultures that we've never had before. When we have a blood culture drawn to test a patient for septicemia, the bottles get put in an incubator, and then when it comes up positive, we do a gram stain on it. And so that kind of helps the doctor determine what organism it is, but they really don't know. So this actually will take a sample of that, and it will test the DNA of that bacteria and tell us what bacteria it is, and then that can help the doctor know more about how to treat the patient. And then for stools, it has actually expanded our testing for the stools. We used to only do bacterial infections like Salmonella and E. coli, and now we can do some viruses, which is nice because we had to send that out in the past, and it could take a week to get those results back. So doctors didn't really order them often because by the time we got the virus result back, the patient was over their symptoms, and it wasn't.
So you could just determine that it must have been viral then.
Right, yeah. Well, and then it's peace of mind for the patient.
Sure,
They knew it was viral.
Yeah, absolutely.
So I think the viewers would be interested in knowing how much quicker we can get results now on some of these molecular tests.
Yes, we are very excited about that. A stool culture, we had to actually culture on plates before and incubate it overnight and look at the bacteria, where now we just directly test from the sample. So it used to take us 72 hours to get the final results out, and now we can get it in as little as 3 hours to the physician. So that is a great improvement for stool samples. So we're very excited about that.
And that's just as accurate as the old way of doing it for 72 hours.
It's actually more accurate than the old way because with normal bacteria you just have in your intestinal tract, it could mask the pathogen and we wouldn't necessarily catch it. So this, it actually tests the DNA, so it's very more accurate, much more. Great.
Very nice.
Yeah.
Very.
And then with the blood cultures, the same thing. We would do the gram stain and give the doctors that result, and then we had to put it on plates and incubate it overnight and then look and test the bacteria, and then it would take a whole nother day just to tell them what the bacteria was. So it's 2 days quicker just to let them know what the bacteria is. So it's a lot faster.
Carly, could you share with the viewers the value of that turnaround time and the improvement?
Yeah, it is such a great value because it just helps with the doctors, 2 days faster. For the stools, if it was a bacterial infection, they get treated with antibiotics. If it's viral, they just get treated with symptoms, but it gives patients peace of mind that they know if it's viral or bacterial, and so it just helps the doctors treat better, and especially with the blood cultures. A lot of times, well, not a lot of times, just sometimes we could get contamination from bacteria that's on your skin, and just from the gram stain, the doctor doesn't know if it's contamination or if it is truly a pathogen. So this will help aid the doctor know, well, it was just got picked up from the skin. We don't need to treat the patient with antibiotics. So that is really helpful for the doctors.
This kind of sounds a lot like, it ties into a lot what Craig was saying about how it's important for doctors to know exactly what type of bacteria they're prescribing antibiotics for. And this kind of allows them to do that so they can prescribe the right antibiotic for the right bacteria.
Correct.
Oh, absolutely.
Awesome,
Yep.
awesome. Well, Carly Thayer, lab technologist, I should say, here at Mile Bluff Medical Center. Thank you so much for joining us today.
Thank you.
I also want to thank my other guests, Lisa Beers, staff pharmacist, Craig Griffiths, director of pharmacy, and Stan Machachok, director of laboratory. Thank you so much for joining us today, guys. It was a pleasure talking with you all. That's all for Wisconsin Doctors. From all of us here at CW57 and Mile Bluff Medical Center, we're inviting you to live longer, live better. We'll see you next time.